Let's talk about why you might need to take vitamin supplements as you get older. It's a topic that's important for many seniors, but there's a lot of conflicting information out there. So, let's break it down and look at what the science says. As we age, our bodies go through all sorts of changes. Some of these changes can affect how we absorb and use nutrients from our food. This means that even if you're eating a healthy diet, you might not be getting all the vitamins and minerals you need. Now, you might be thinking, I eat plenty of fruits and vegetables. Why would I need supplements? That's a great question. Eating a balanced diet is always the best way to get your nutrients. But, and this is a big but, sometimes our bodies need a little extra help as we get older. Let's start with vitamin B12. This vitamin is super important for keeping your nerves healthy and helping your body make red blood cells. The problem is, as we age, our stomachs produce less acid, which makes it harder for our bodies to absorb B12 from food. So, even if you're eating plenty of B12-rich foods like meat, fish, and dairy, you might not be getting enough. Another vitamin that becomes more important as we age is vitamin D. You might know it as the sunshine vitamin, because our bodies can make it when our skin is exposed to sunlight. But, as we get older, our skin becomes less efficient at producing vitamin D+. Many older adults spend less time outdoors, which means less sun exposure. Calcium is another nutrient that deserves some attention. We all know it's important for strong bones, but did you know that our bodies become less efficient at absorbing calcium as we age? This is especially true for women after menopause. That's why doctors often recommend calcium supplements for older adults, especially those at risk for osteoporosis. Now, let's talk about antioxidants. These are compounds that help protect our cells from damage. As we age, our bodies produce more free radicals, the bad guys that can damage our cells, and fewer antioxidants to fight them off. This is where supplements like vitamin C and E can come in handy. But, and this is really important, more isn't always better when it comes to vitamins. Taking too much of certain vitamins can actually be harmful. For example, too much vitamin A can weaken your bones, and excessive iron can damage your liver. That's why it's crucial to talk to your doctor before starting any new supplement regimen. Your doctor can help you figure out which supplements you might need based on your diet, health conditions, and any medications you're taking. They might even recommend a blood test to check for specific vitamin deficiencies. Now, you might be wondering, can't I just take a multivitamin and call it a day? Well, it's not quite that simple. While a multivitamin can be a good insurance policy, it might not provide enough of certain nutrients that older adults need more of, like vitamin D or B12. Plus, some multivitamins contain iron, which most older adults don't need extra of unless they have a specific deficiency. Let's talk about a few specific vitamins and minerals that are often recommended for older adults. Vitamin B12. As we mentioned earlier, B12 absorption can decrease with age. Some studies have shown that up to 20% of older adults may be deficient in B12. Low B12 levels can lead to anemia, weakness, and even cognitive problems. If you're over 50, your doctor might recommend a B12 supplement or B12 fortified foods. Vitamin D. This vitamin works hand in hand with calcium to keep your bones strong. But it also plays a role in muscle strength and balance, which can help prevent falls. Some research suggests that vitamin D might even help boost your immune system. Calcium. While calcium is crucial for bone health, it's important to get the right amount. Too little can lead to weak bones, but too much can cause kidney stones and other problems. The recommended amount changes as you age, so it's best to check with your doctor. Magnesium. This mineral often flies under the radar, but it's involved in over 300 processes in your body. It helps with everything from regulating your heartbeat to supporting your immune system. Some medications commonly prescribed to older adults can interfere with magnesium absorption, so a supplement might be necessary. Omega-3 fatty acids. While not technically a vitamin, these healthy fats are often recommended for older adults. They're thought to help with heart health, brain function, and reducing inflammation. If you don't eat fatty fish regularly, your doctor might suggest a fish oil supplement. Now, you might be thinking, this all sounds great, but supplements can be expensive. That's true, and it's a valid concern. But consider this, the cost of supplements might be less than the cost of health problems that could develop from nutrient deficiencies. Plus, many insurance plans cover certain supplements when prescribed by a doctor. It's also worth noting that not all supplements are created equal. The supplement industry isn't as tightly regulated as the pharmaceutical industry, so it's important to choose high-quality supplements from reputable brands. Look for supplements that have been tested by third-party organizations like USP or NSF International. Let's talk about some key vitamins that can be helpful for managing diabetes, kidney health, blood pressure, and neuropathy. It's important to remember that while vitamins can play a supportive role, they shouldn't replace prescribed medications or a healthy diet. For diabetes management, a few vitamins and minerals have shown promise. Magnesium. This mineral helps with insulin sensitivity and blood sugar control. Some studies suggest it may improve fasting blood glucose levels in people with diabetes. Vitamin D. Research indicates that vitamin D supplementation may help reduce insulin resistance, especially in people who are deficient. Vitamin B1, thiamine. Many people with diabetes are thiamine deficient. The benfotiamine form of B1 may help with some diabetes complications. Alpha-lipoic acid, ALA. This antioxidant shows potential for improving insulin sensitivity and reducing fasting plasma glucose. When it comes to kidney health, a few vitamins are particularly important. B vitamins, B6, B12, and folic acid work together with iron to prevent anemia, which is common in kidney disease. Vitamin D. This is crucial for maintaining healthy bones, especially in people with kidney disease. Vitamin C. It helps keep tissues healthy and aids in wound healing. However, large doses should be avoided in kidney disease as they can lead to oxalate buildup. For blood pressure management, magnesium. Some research suggests it may help lower blood pressure. Vitamin D. Studies indicate it might help improve blood pressure, though results are not conclusive. Potassium. While important for blood pressure regulation, people with kidney disease need to be careful with potassium intake. For neuropathy, particularly diabetic neuropathy, alpha-lipoic acid, ALA. This antioxidant shows promise in treating diabetic neuropathy. B vitamins, particularly B1, B6, and B12, which are important for nerve health. Vitamin D. Some research suggests it may help with neuropathic symptoms. It's crucial to note that while these vitamins can be beneficial, they're not a cure-all. If you have diabetes, kidney disease, high blood pressure, or neuropathy, always consult with your healthcare provider before starting any new supplements. They can interact with medications or cause issues if taken in large amounts. For instance, if you have kidney disease, you might need to avoid or limit certain vitamins like A, E, and K, as these can build up in your body and cause harm. Your doctor might prescribe special renal vitamins that are formulated specifically for people with kidney issues. Remember, the best way to get vitamins is through a balanced diet. But if you have specific health conditions or dietary restrictions, supplements might be necessary. Your healthcare team can help determine what's right for you based on your individual needs and health status. Lastly, keep in mind that supplements aren't regulated as strictly as medications. If you do take supplements, look for products with a USP, United States Pharmacopoeia, seal, which indicates that the supplement meets certain quality standards. Taking care of your health is a team effort. Work closely with your healthcare providers, eat a balanced diet, stay active, and if needed, use supplements as directed. With the right approach, you can support your body in managing these complex health conditions. Remember, supplements are meant to supplement a healthy diet, not replace it. The best way to get your nutrients is still through a balanced diet rich in fruits, vegetables, whole grains, and lean proteins. But for many older adults, supplements can provide that extra boost to help keep you feeling your best. So, what's the bottom line? As you age, your nutritional needs change, and your body might need some extra help getting all the nutrients it needs. Vitamin supplements can be a useful tool in your health toolkit, but they're not a one-size-fits-all solution. It's important to work with your healthcare provider to figure out which supplements, if any, are right for you. Taking care of your health as you age is about more than just popping a pill. It's about eating well, staying active, getting enough sleep, and yes, sometimes taking supplements. But it's also about enjoying life, staying connected with friends and family, and continuing to learn and grow. So, the next time you're at your doctor's office, why not bring up the topic of vitamins and supplements? It could be the start of a conversation that helps you feel your best for years to come. After all, aging is a privilege, and with the right care and attention, it can be one of the most rewarding phases of life.